about the chickenpox vaccine. And if you look under who should not get a chickenpox vaccine, it says you do not need to get the vaccine if you have evidence of immunity. This is like every infectious disease known to man. Also from the CDC's website, myth, the natural immunity I get from being sick with COVID is better than the immunity I get from a COVID-19 vaccine. And the fact they say is getting the vaccine is a safer, more dependable way to build immunity to COVID than getting sick. It's safer, more dependable immunity. Added protection above natural immunity. And effective, they say, at preventing COVID, preventing infection. They say in their website, it may protect you. If you get a vaccine, it may protect others around you from getting the vaccine. I'm curious to know if anyone on the panel has an opinion to agree or disagree with any of that. I'm glad Scott reached for the mic, because last week we were talking about this, and we were talking about something, and I said, well, Scott, I know you're not an immunologist, but, whatever I said, and he said, well, actually, I did get a graduate degree in immunology, so. But that's like Scott, he's always blowing his own horn. All right, Scott, stand up, if you would, and what thoughts do you have on natural immunity versus vaccine?
Well, it's been proven through the ages that natural immunity is the way you beat any disease. Vaccines have attempted through the years to enhance our ability to beat disease, and in some cases, in diseases that don't, or bugs that don't mutate, it's very successful. But, you know, it's already been disproven that the vaccine gives better immunity than natural immunity. There's just no debate in that anymore. Every time we look at natural immunity and how long it might last, we looked at it at 3 months, and they said, oh, look, after a natural infection, you still have strong antibodies against the virus at 3 months. So then we looked at it at 6 months, then we looked at it a year, and guess what? You still have strong antibodies after a year. We have memory B cells and memory T cells that are going to continue to protect us from this disease. So that just blows me away. The CDC had that on their website. Because, first of all, if fact checking now is bought and paid for. I think you all know that. If you see a fact check on the internet, don't believe it. But the myth is actually their fact, and the fact is their myth. They flipped it around on us.
Anybody else have an opinion? Hans?
Yeah, I wanted to say something about chickenpox. What they neglect to mention on the CDC website is that the death rate in chickenpox is 1 in 100,000. Now, when I was a kid, somebody in the block got chickenpox. Our mothers rushed us down for coffee. And you can't tell me that vaccinating 100,000 kids doesn't result in the death of one of those kids. So you're looking right there at the simple mathematics. The vaccine is at least as dangerous, possibly more dangerous, than the disease. This is just a thing to sell vaccines. And if you look at all the childhood diseases, pertussis, measles, these are not diseases that really kill people. Back in the day, when nutrition wasn't that good, and public health, there were public health problems, the death rate was higher. Now we're looking at vaccines for diseases that really don't kill people, and the vaccines kill people. So I just wanted to say, and COVID is the same thing. It started out twice as deadly as the flu, but we didn't find that out for a long time. They showed us pictures of people falling over in the street, caskets stacked up, refrigerated trucks outside the hospitals in New York. They wanted us scared shitless and begging for that vaccine. The truth of the matter is, when it started out, it was twice as deadly as the flu, and now it's 1/6 as deadly as the flu. and still they've got us lining up for the vaccine.
Is it less deadly now because we got so many people vaccinated?
No, it mutated. The natural history of a respiratory virus is it mutates, it becomes more infectious and less deadly as time goes on. And it only makes sense. If you've got a virus that kills its host, it's not going anywhere. It's got to learn how to not kill the host. Then it can spread everywhere. And that's what respiratory viruses do, and that's what this one has done. So
Thank you. Does anybody have any thoughts, anything else to add, or how about on the idea that the vaccine will protect people around you? I mean, after all, the whole idea of mandating a vaccine, or at least a big part of it seems to me, would be that it would prevent others from getting the infection. Is that true? Jim, do you want to?
Sure. So I think that's been fairly disproven. I don't have the articles in front of me. I know that I was fully vaccinated, my wife wasn't, and I got it and gave it to her, so I didn't protect her or myself with the vaccine. So I would like to say something about vaccinating children. And I haven't looked at the data in the last few months, but during COVID, since this started, more children still died of influenza than COVID. So, and that data, I don't know, Joe, I think you and I talked about that data once. It may be 6 months old, but when you think about it, we kind of forgot about influenza. Children die every year in the state of Wisconsin from influenza. Every year we have deaths. And I think the average number of people with influenza per year is about 50,000 deaths per year. Does that sound about right? Okay, it varies from year to year based on the strain. It seems kind of silly that we're doing what we're doing for COVID and not worried about influenza anymore. How many schools get closed for influenza? Businesses? It's a little crazy. A lot of this to me is common sense. The data helps, but a lot of it's just common sense. And I think that's what Hans was getting at.
Just to piggyback off what you said, one of the...
Gotta stand up.
Oh, I
or you're
do?
not gonna get video.
Maybe I don't want people to see me. A couple of things. First of all, pertussis and rubeola vaccines protect the youngest. So pertussis, yes, it was years ago, but if you see recurrent infectious outbreaks, babies basically suffocate to death. So I understand that preventing a few of those by childhood vaccination is a legitimate point. And you're getting this from somebody who grew up without vaccinations. So my parents believed that all vaccines were bad, and I was not vaccinated until I was 18. The only reason I did it was because I was sick of filling out the paperwork when I wanted to work at a hospital. So, and I can't say anything bad happened to me because of it. But back to what you said, Dr. Clemens, we do have evidence, but I see it in my church community where people tend to have very large families, where 5 or 6 people in a household of 8 will have COVID, and 2 people won't get it for whatever reason we don't know. This was before vaccination, so we saw this phenomenon where members of a household would spare a couple of people. Don't know why. There was some thought that it may be due to cross-reactivity to prior coronaviruses in a paper published in, I think it was September 2020 in Nature magazine. Don't know the answer, but when you're looking at comparing 2 separate things, a vaccinated group and a non-vaccinated group, so it's the gold standard of science, is comparing 2 cohorts. You have to look at, when you're looking at if it spreads from one person to the other, you don't know the natural spread in the unvaccinated population. So that's my whole problem with the science as it's presented. We know the gold standard of medicine is a double-blind, placebo-controlled study. My question is, where is the comparison group?
So that's a good jumping off point for this. I don't need that.
Oh. Should I drop it?
Yeah, you could. This is the CDC's famous Kentucky study. And if you ask people advocating for the vaccine or mandating it for hospitals and workplaces, very often they will refer to the CDC's Kentucky study. And I don't know if anybody on the panel is particularly want to talk about this. I know Hans, I know you know this very well. The CDC made this study. They were the author of it, and then they used it to advocate for mandating vaccines. They came out with a second study later. They refer to that as the hospital study, but it was the second CDC study that advocated vaccines even if you've already had natural immunity from the infection. No, you got to get a vaccine because it's better. Now, there have been many, many flaws with this study. In fact, there are more articles out there that specifically debunk this study than there are any other articles agreeing with this study, if that makes sense. The only two studies that you can find that will say that vaccinating, the only two studies I could find that say that vaccinating someone in addition to natural immunity is helpful would be this and the CDC study. On the other hand, this is a website from what's called the Brownstone Institute. And this is an article where they've compiled 150 plus research studies that affirm natural immunity, acquired immunity from the infection, is better than the vaccine. And they're documented, they're links. We'll have a link for this on the website. I don't know if anybody wants to talk about that or moving on. You want to talk about that?
Well, I just had one.
Go ahead.
You hear me? So, related to what you said, I think one important point is which variant are we talking about? Because a lot of the studies that have come out, especially recently, have shown that vaccine efficacy with respect to the Omicron variant is much lower than the original vaccine. In fact, the studies that they're doing now, the ones that I've seen, are showing negative vaccine efficacy after 3 to 6 months, meaning you actually might be more likely to contract COVID due to the vaccine. And there's various mechanisms they've purported for that. But yeah. I just think point should be made that we're not just talking about COVID. We're talking about the different variants, and as I think it was Jim who mentioned how they mutate. The studies are now showing that vaccine efficacy is waning very quickly, which hence all the different boosters that they're now trying to push. And in fact, I don't know if you guys have an opinion on the negative vaccine efficacy studies that have been done either.
Yeah, we're actually going to get to that a little bit later. I want to point out one thing. I think it's down in this area here. Oh no, there it is. It mentions a study in Wisconsin. It's one of these cited in the Brownstone Institute. The Wisconsin study, in addition to showing, it had a big role in showing that the vaxxed and the unvaxxed, whether you're vaxxed or not, you can still transmit the infection. It doesn't protect your neighbor. It doesn't protect people that your coworkers. And also studies that you'll find here debunk the idea that masking, the word is essentially ineffective. I think it's very fair to say, if you have a cough or you're sneezing and you cover it, or you cough into your sleeve, that makes sense because you've got big droplets spreading out. But if you have an aerosolized spread, which is what COVID is, then it's not going to be effectively stopped by a mask, right? The N95 mask, we talked about this before, the N95, if you wear it properly, filters down particles down to 0.3 microns. The COVID virus, as it's circulating in the air, is 0.125 microns. So this is like the difference, the ratio is the same as from a softball to a golf ball. So what I explain to patients is if you have Tiger Woods at the tee box and he's rapid fire driving at you and you're standing in front of him and you have a fence that can only stop things bigger than a softball, that's going to be a bad day for you. And if you take a cloth mask or one of these paper masks, not the N95, that's kind of like expecting your chain link fence to keep out the mosquitoes. It's really that sort of a scale that we're talking. Go ahead, Hans.
Yeah, there's a couple different ways to look at masking, and the particle size is very interesting. The virus is smaller than a molecule of gasoline. So now, put on a mask, put on the best mask you can find. N95, whatever, respirator, spill a little gasoline on the floor. Can you smell gasoline? Of course you can. Gasoline will go through anything, and the virus is smaller than a molecule of gasoline.
This next slide is maybe my favorite.